Frontline workers across the country are scrambling to combat the new variant Omicron as hospitalizations in the U.S. rise. Today, the CDC signing off on booster eligibility for Pfizer's COVID-19 vaccine to include 16 and 17-year-olds, less than a month after authorizing booster shots for everyone 18 and older who had received Pfizer shots. For more on all of this, I want to bring in Chief Innovation Officer at Boston Children's Hospital and ABC News contributor, Dr. John Brownstein. Thanks for being with us, Dr. John. It's good to see you, friend. So what do you make of this latest move from the CDC?
Yeah, hi, Kenneth. I think that this is actually a reasonably big deal. This is 2.5 million kids aged 16 to 17 that will now be eligible for a booster. And, you remember, Pfizer actually has been available for 16 and over since the beginning, but boosters only 18 and over. And so now you're taking this group, which is a substantially large age group, and saying that they can now get boosted. And this is important because we have a Delta surge, we have the threat of Omicron, and kids really do make up a large portion of cases. About a quarter of the cases are in the pediatric population. We're seeing a major surge in cases. We have the concern about this inflammatory syndrome. So all this together, the benefits of a boost outweigh any risks of concerns around any cardiac events that we've seen historically. In fact, in Israel, they've actually already made the boosters available for teens, and it's worked out incredibly well. I think there's still that open question of under 16 and boosters, and more data is needed. But I think for this age group, it makes sense to start rolling out these boosters with this impending surge.
And Doctor, I got my booster on Tuesday. I was out for the count a little bit yesterday, but I came back soaring. I've rebounded today, and I'm right here on ABC News Live. I have to ask you, though, Pfizer recently said a fourth shot may be needed eventually. Our chief medical correspondent, Dr. Jen Ashton, spoke with CDC Director Dr. Rochelle Walensky and asked her whether the definition of fully vaccinated could change. Take a listen.
So for now, the definition of fully vaccinated is 1 dose of J&J or 2 doses of one of either Pfizer or Moderna. We are looking at the data right now. We're right in the middle of a time where we're going to have a lot of science. What does the protection of the booster mean for Omicron? What are we seeing on the protection of the booster for Delta? How much Omicron is going to be here? And what is the, do we need an Omicron-specific booster? Mm-hmm. And as those data, just in the last 24 hours, we've seen data emerge and numerous studies emerge. So as those data are emerging is where we will look to see if that recommendation needs to be changed.
Doctor, with my arm a little sore right now still at the injection site, I'm paying close attention to this. So do you think that the definition of fully vaccinated should change?
Yeah, so the CDC director is right. More and more data is coming in daily. So we have to move with the data. That being said, it is being clear that boosters are going to be more and more the path to the future. And I think the definition of vaccinated will change over time. Think about your flu shot. You get that every year. You're only immunized every year based on the flu shot that you get that year, not from a flu shot you got 3 years ago. And I think that's probably the same here. We're seeing more and more that boosters are becoming incredibly valuable. Even before Omicron, we were showing that you could reduce your risk of death from COVID by getting that booster. There was a recent New England Journal of Medicine study that came out yesterday talking about this. But now with Omicron, it's clear that that booster can bring you back that immunity that you may have lost. And so with all this data together, I think it's becoming clear that a booster is important. Now, the primary vaccinations are probably still super important for severe illness and death, but I think overall, I think that 3-shot regime is probably where we're all headed to.
All right. And right now also, at least 31 states and D.C. are seeing an increase in hospital admissions. The U.S. is now reporting more than 117,000 cases each day, a jump of nearly 83% since late October. New pediatric COVID cases are up 884% from just last month. I give you all those numbers to tee you up here, Dr. Brownstein, to ask you, how do you think this winter surge will compare to a year ago?
I'd like to say that we're going to be in a better spot, but I can't guarantee it for every part of the country. We're seeing places like Michigan having the worst of this pandemic right now. And so unfortunately, every part of this country will experience something different. Now, we have the tools. We have vaccination, we have therapeutics, we have testing. So we don't have to make it as bad, but it is, of course, on us to get on board with vaccination. We still have over 70 million eligible people who have yet to get that vaccine. So there's still more we could do to prevent a surge. I'm in Massachusetts. We're in the beginnings of one right now. There is more that we can do around masking, social distancing. We can get around this, of course, especially as we head into a potential surge around Omicron.
There's more we can do. All right, Dr. Brownstein, thank you for your time. We appreciate it.
Thank you so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.